Anyway, thanks everybody for being on this call today. Um, I am, in case you don't know, I'm Dr. Martha Buchanan with the Knox County Health Department, and we're going to talk about our phased reopening plan this afternoon. And for those of you who were on the call earlier, my intro will not be the same because I didn't write anything down. So I'm just, I'm going to give you kind of a broad stroke overview of the plan and kind of how we got where we are today. So the plan is based on some other plans, some suggested reopening plans from Johns Hopkins and others. So it's not something we sat in a room and made up. We also got some input from business people in town, the task force. I'll let Stephanie or Krista say who's on the task force because I can't remember all of the people because I haven't been to all the meetings. I've just been in the meetings where we're actually writing things. So Stephanie or Krista, jump in and say who's on the task force for me, please.
I'll go ahead and we had on the task force, we had some folks from the business community, Mike Odom, president of the chamber, Dave Miller, who is the regional president for First Horizon Bank, small business owner Ryan Steffi from Sono Taco. So we also received quite a number of plans and recommendations from a variety of business owners, gyms and hairdressers and et cetera, who just sort of sent their plans our way. And then in addition to that, we I've been sitting on the statewide economic recovery task force. And so there's been some business input from that perspective. Dr. Buchanan really chaired the task force ultimately in getting the plan together. This is health department led and informed by public health, with Krista as our fearless writing leader, thank goodness, sort of pulling everything together into one document. And then others from the health department, Catherine Killen, Charity Menifee, who were also involved with that. So myself as well.
Yeah, so it was really a group effort to develop this plan. And I believe we've created a thoughtful, data-informed plan that will help us safely navigate reopening our community and not seeing a spike in our COVID-19 cases and being able to, we'll see a bump up, but hopefully it'll just kind of bump up and cruise along and not bump and keep on going, because that would be an indicator that we want to go back. I think the other thing that's important to keep in mind is that this is not, let's just throw the doors open wide. Everybody can open up for business and it'll be fine. And our COVID-19 cases won't skyrocket and overwhelm the medical system and all those things that could happen that we're seeing happening in other places. This isn't a new normal. This is a reopening after or during a pandemic. So to expect that everybody can just open and it's going to be normal, it's going to be equal across the board is really not a realistic expectation. We had to make some very difficult decisions about parts of the community that should and should not open based on risk and based on how COVID-19 is transmitted and what takes place at certain places. You know, the intent of gathering at a venue is different than the intent of gathering at a restaurant. You don't go and usually, unless you're campaigning, you don't go and shake everybody's hand and kiss all the babies at a restaurant, but you usually do that at a venue. So the differences in how those places are used factored in, and how COVID-19 is transmitted factored in to some of the decision making, and also getting information from other plans that had been vetted as well. So really, I think I'm hoping that our businesses will build on what they've learned from being closed and continue some of those practices. I know I heard somebody say that a gym owner had rented out their spin bikes and was actually thinking about just keeping going on with that because they were making more money that way than having people come to the gym for classes. That's a great inventive idea. I hope more of that comes out. We heard the community that the community wanted to open, and we looked at so when I look at the community, there's the whole public health piece and preparedness piece, and there's our economic health and our emotional health is a piece of this as well. And, you know, we shut things down and kind of our economic health and our emotional health had suffered with that. But when that allowed us to focus on the public health piece and the preparedness piece. And those pieces are in good shape right now. Our case rate is steady. It's just popping up along, not shooting up. The hospital systems can tolerate that. The hospital systems had time to plan. They are ready. They have their surge plan. It's a community-wide surge plan. And for those of you who don't do planning and emergency preparedness and don't work with hospitals, that's not all that common. Hospitals are competitors, and our hospitals have historically come together with public health being the convener and said, we're going to do the right thing for our community. And they really have done this. So all of our hospitals are part of that plan. And even some of the regional hospitals are also part of that plan. So they've gotten their things together, had time to activate and send out strategic national stockpile supplies. So hospitals have the things they need to be ready. And so does, and we have we have most of the things that we need to be ready as well in public health. And it allowed my staff time to try out a couple of different models of how we do contact tracing and decide, you know, how many people do we need to be on a team? So when we have to staff up, how many people do we need to get to add a new team? And we tweaked that. The first time we didn't work as well. So we tweaked it a little bit. And so, and it's kept our case counts down, and our death rate is low. And so we feel like it's appropriate for us to take this next step and say, okay, let's open the door a little bit and try a little bit of, you know, releasing of the guidelines and releasing of the restrictions and see how that goes. We will continue to look at all of those data pieces together to be able to decide if and when we go to the next phase. It's not a given that we go to the next phase in 28 days. So I think that's important to keep in mind too. This is really a data-driven document and data-driven process. So we don't get to go to the next phase until we've met all those benchmarks going forward. So I think we're asking the community 5 core actions we're asking all of the community to do. And that's physical distancing, staying 6 feet apart, 6 feet away from each other when it's possible, not gathering in groups more than 10, and really continuing that physical distancing or social distancing, no mass gatherings. And when you can't maintain social distancing, wearing a face mask. I've really taken to wearing a face mask anytime I go to the store. Just that protects the other people, really doesn't offer me any protection. Washing my hands is going to be my protection. But wearing that face mask helps other people. And if you think about it, if you say, oh, I don't want to wear a face mask, think about that bag boy or the girl checking you out at the grocery store or whoever is serving you. You know, you're protecting them so they can keep working and feeding their kids. So think about that. I mentioned one other thing, proper hand washing. I'm never going to stop saying that. So it's always true that you need to wash your hands and you need to clean things and keep things clean. And we're asking businesses to kind of step up their cleaning process. And then the other really important thing you guys hear me say all the time is stay home if you're sick. And we want employers to allow for people to stay home if they're sick, because that's not always true, especially in some industries. And also stay home if you've been asked to isolate or quarantine. That protects our community. One of the things that, you know, we do as part of our contact tracing is, so, you know, Martha Buchanan has COVID-19. Who are all her contacts? We're going to reach out to all her contacts and tell them to stay home. And what that does is help breaks that transmission cycle. They stay home long enough to see if they're going to get sick. And then they're not out in the community making somebody else sick before they get sick themselves. So that breaks that transmission cycle. And that's our job, and we'll keep doing that. But please, all those things need to happen. And we've kind of talked about benchmarks. I think we're going to shift from looking primarily, and if you look at our website now, you'll see this, looking at cumulative cases to looking at active cases or new cases. Because, you know, the cumulative cases have gotten really kind of big, 200, but we really only have like 30 active cases. So that's a more realistic picture of the level burden of disease currently right now in Knox County. And that new number range the last couple of days, it's been up a little bit. State's been doing testing has increased, so we're seeing increased cases. I'm not surprised by that. So we're going to be looking at that. as we go forward. I've talked about,
Dr. Buchanan, you
so-
froze. Can you
yeah.
go back over that?
I'm sorry?
You froze for about 5-10 seconds. Can you repeat that?
Sure. I'm not sure. Okay. Repeat the part about, help me. I froze. Is that what he
Yeah,
said?
you just froze just a little bit for the
Okay.
last 30 seconds or so.
Okay. So, looking at new cases, I'm not sure when I froze. So, looking at new cases, as opposed to just looking at the cumulative case count,
Yeah.
that gives us a better picture of what the actual current burden of disease is in our community. And I've talked a little bit about benchmarks and how we decided to get here, but again, we're going to look at what are our case counts doing? Are they going up? They staying about the same over a time frame. The incubation period of COVID-19 is 14 days. So if we see a kind of a steady state for 14 days, we feel pretty good that we're in a good place where we can start making new decisions. But that's not the only thing we're going to look at. We also want to look at whether testing is going up and down. If you look at our website, what we'll be able to report is trending in testing. We can't report absolute numbers of tests because we just don't get that number from private providers. But we're going to look at trending in tests. Is test capacity going up, staying steady, or going down? It's really kind of that simple. And again, our capacity, the hospital's capacity, and then also deaths. We'll be tracking deaths. We've only had 5. Very grateful for that because it certainly could be worse than that. But those are the things we'll be looking at as we move forward toward phase 2, thinking about reopening. Again, for phase 1, some general guidance for everybody, the 5 things I talked about earlier, plus high-risk individuals, we're really encouraging them to stay home. They're higher risk for complications. So, what we're asking our community members to do is support those folks. Go buy groceries for your elderly neighbor or something like that so that they don't have to go to the grocery store. I know a lot of grocery stores are doing early mornings for the elderly, kind of reserving that time for the older folks. And I think that's a great idea. In addition to that, we're also asking employers to have a plan, have a coordinator, and have a plan. How do you allow social distancing in your facility? Having masks for their employees, having masks for people, asking people to wear masks, screening their employees for illness. In some places, screening the clients for illness as well. So we're not just saying do all this stuff and bless you and go do it. We've also are creating resources for everybody. So I mentioned the coordinators. The coordinator is going to be able to sign up for a listserv, and that listserv will be a way for us to push information out, but also a way for them to send feedback back to us as we think about building phase 2. We've also put signage out there so it's consistent. It's coming from us. It's not coming from them, and they're all doing the same thing that people can use to post in their businesses. And there are 3 ways people can get information: the listserv, 311, and then we have a team of folks who are, for lack of a better word, there are experts. There are go-to people for certain industries, and those folks have volunteered to help us with that, and we're really grateful. And that system is actually already working to provide guidance to industry as they try to reopen. There's a lot more in the plan, and I don't want to. I'm not going to go through the whole plan with you. We'd be here a really long time, and I've talked for 15 minutes, so I'm going to open it up for questions. And oh, there are some questions. Okay. Are you going to read, Stephanie, or are you? Okay.
I'm unmuting right now.
Okay.
So and please feel free, everybody, to go ahead and send your questions. We can, folks can raise their hands as well, but it's a little bit easier to manage, honestly, if folks send them in through the chat function. So a question from Commissioner Daly: what's the status of PPE inventory for all of medical, and an update on test kits?
So right now, the Strategic National Stockpile has been released for PPE for hospitals and health. And I think TEMA is doing healthcare providers, other healthcare providers. Those shipments have been released, and right now our hospitals and most healthcare providers are in pretty good shape for the PPE that they need. There's a system in place for them to request when they need more. And that goes up to the state to be fulfilled by the state through TEMA, or the stockpile is already out. So it's really TEMA that's fulfilling those orders right now. So as far as test kits, I can only speak to the number of test kits we have. I have not heard of our hospitals or any medical providers needing test kits, but they have a way to request those that doesn't include us. We don't have to be involved in that. So that happens outside of our purview. Right now, the health department is set for our weekday testing and potentially to do some more surge events. So, and we're requesting and getting more equipment in every day.
Dr. B, I know one of the questions that came in earlier, kind of in follow-up to the testing, what's the testing strategy going forward, as we know that there are going to be more cases?
Mm-hmm.
And then the health department has a really comprehensive contact tracing plan, and you might be able to touch on that a little bit.
Sure. So our testing plan going forward is we're going to continue our weekday testing. We'll be doing that anywhere from 3 to 5 days a week. In a drive-through model, the nice thing about the drive-through model is that it helps us preserve PPE. So that really is useful. In addition to that, we're looking at data. And again, we're going to really look at the data of what zip codes people have come to us to be tested for. So looking at data around the county and looking at zip codes that have less testing and thinking about where could we do testing in that particular zip code or area. So trying to use data to make sure that we're getting adequate sample from around the community. The other way to look at that is we might throw in there the outpatient testing sites that are also available that aren't ours. Those are independent, either walk-in clinics or whatever. So again, where might there not be access to testing? That's where we want to go to test, because when folks have access, we want to let them get that there. We, the health department, cannot be the only group testing in the community. Testing has to also rely on private providers. It's not feasible for us to do that. And that our system's set up for that. When we talk about contact tracing, my staff is really dedicated to contact tracing, and we reach out and talk to every contact of every case. If we get to where Nashville is and we have, it may reach a point where we're not able to do that, but we are dedicated to doing that as long as we possibly can. So what that means is we have a conversation and we talk to every contact of every case so that we are checking in with them. We're aware of what they're doing. We've advised them on what they should do. And it's really important that we kind of develop a rapport with them so that if they have a question or if they have a concern or if they get a symptom, they're going to call us and they're going to ask us questions and ask us what to do. And we're going to help facilitate getting them tested. So we believe the system that we have is really vital. We're not just sampling some contacts, we're reaching out to all contacts. We know those contacts are going to go up. And if you look at the data on our website, we have a plan to mobilize and have over 200 people to help with contact tracing, just by activating some other Knox County team members, not just from the health department, but across the county. So I feel good about that. Did that answer your question, Stephanie?
Yeah, no, that's really good. I just want to mention that just in some of the calls that I've been on with health departments in other parts of the state, Knox County Health Department's model for contact tracing is really held up as a great model for others to follow. They've trained others in contact tracing. So we need to be really proud and grateful to our health department for that. Councilwoman Parker has a question, and I might be able to help with part of this. Her question is, can you share by email the guidelines for the guest house and how long the guest house will be open or will be available to quarantine homeless neighbors who become sick? I can check with Bruce Spangler on their standard operating procedures at the guest house. Councilwoman Parker, Dr. Buchanan might kind of generally discuss how that's working if she doesn't mind. And I can tell you that we have a 3-month initial contract with the guest house, and we'll just continue to reevaluate the need if it goes beyond that.
Right. So honestly, that the guest house is being, now that it's up and running, is being run so well. I honestly don't exactly know how it's working, because we're not really involved anymore, which is great because we're focusing on this other stuff. One of the things we did here that I don't know if it's unique or not, but we activated our emergency operations center for the purpose of addressing those social needs, acknowledging that there will be increased social needs for folks who either are homeless or virtual, or on the verge of homelessness, and they've been doing amazing work. So we have families in quarantine or isolation, and they need groceries and food, and they've been helping them get those things. So it's really worked well. I've been really thrilled with how that's worked, and the guest house is part of that, and that's running so smoothly. I really don't have a lot of information, but Bruce would be the person to have the information on what the process is. So if Stephanie can connect you with that, Councilwoman Parker, that would be great.
I know, and I will ask Bruce for that information, but I will say that Dr. Buchanan and her team really worked with Bruce and the homeless service providers on the front end to make sure those protocols were in place. And they've really picked those up and put those in place. So I'll talk with Bruce about getting that. Commissioner Daly has a question with drive-through testing. How many of those tests have been administered and how many have been positive? Can you talk a little bit about the drive-through testing?
So we're doing drive-through testing during the week and on the weekends. We've had 2 weekend drive-through testing events, one at the zoo in partnership with Kroger. And at that particular event, I think we tested, that was a long time ago. I want to say we tested almost 1,000 people, but maybe not. That could be high. I probably shouldn't say that. Not many of those were positive, I'll be honest. I don't have that data in front of me, and I don't have it off the top of my head. Our weekday testing has more than tripled since we started doing drive-through testing. Actually, we've kind of always been doing drive-through testing. We tweaked our model. Yesterday, we tested over 100 people between the hours of like 9 to 2 or something. That gives our staff time to get there and set up, get everybody through the line, and then break down and do their data entry. So they're not here till 7 o'clock at night doing that. And I don't have the data off the top of my head for how many of those were positive. We did also a test and drive-through testing in shoot 37915 at the Coliseum in partnership with the city. And we tested right around 400, 500 people on that event. We did not have a lot of positives in that either. I can get you that data. I just don't have it off the top of my head, and I apologize for that. I actually meant to have it and it slipped my mind. So I can ask somebody to get that data and we can send it out.
Thanks, Dr. B.
Yeah.
We have another question from Councilman Thomas. Are masks available for members of the public who haven't been able to get them? If so, where can they get them? And
Can I chime in here on this one real quick? I'm going to send a link from the CDC that has 3 different options for homemade masks. And 2 of those options involve no sewing at all. You don't need a sewing machine. You can either use a t-shirt or a bandana or a random piece of cloth. So I'm going to send that in the chat, and then I'm going to let Dr. B or Stephanie address the rest of that question.
Great. Thanks so much, Krista. Dr. B, do you want me to take that, or would you like
Sure,
to?
go ahead.
Okay. Because, again, the health department is really coordinating the public health response. And I think the community has really stepped up to help with some of these other things. So there are several folks locally who are making masks for sale that we've heard of. We found them on Facebook. I know that Prestige Cleaners is making masks, and there are some other local purveyors who are doing that. We learned yesterday, and I've connected Dr. Buchanan since our call this morning, Unified Command, which is a statewide cross-organizational group that the governor has convened, is going to be sending out 5 million masks across the state over the next few weeks. The first shipment of 400,000 masks will be coming out next week and will be distributed through health departments. So people will be able to go to the health department to get a mask. And I think those procedures haven't been set up yet. Some of this is happening pretty quickly, but there will be masks coming out through that mechanism as well. The city is also working through Chip Berry to do some collection drives around, we call them face coverings, cloth face coverings, so that we can make sure that people who don't have access to those can get them. So there are a couple different ways that are going on, and there may be a way that we can sort of centralize that information on a website through the health department's website or city's website, but we realize that is a need. Let's see. Krista posted that that mask resource. I don't see any other questions. Krista, let's see there's another chat question. Good. Vice Mayor McKenzie has asked, have we made any progress in partnership to assist with testing the underserved and African-American communities? For example, Cherokee Health on MLK and Western Ave, the Free Medical Clinic on Magnolia Ave. Testing questions. So Dr. Buchanan, is that something that you would like to answer?
Sure. I do have one clarification. The Free Medical Clinic on Magnolia, I'm sorry, I'm not familiar with that. Is that?
So I think that is.
Yeah, Dr. Buchanan, I'm sorry. The Free Medical Clinic on Magnolia, that is a volunteer group of clinicians. I think primarily the physicians come from UT Hospital, and then there's nurses from other places. It's offered on Mondays on Magnolia, and then on Thursdays at Greater Warner Church. Okay. It's been in existence for several years, and it looks like they get a high volume of traffic of people. So I just wanted to put them out there as a potential partner. If there's some possibility of testing, we could see if they'd be willing to help.
Yeah, sure. Again, we continue to look at different ways we can test populations that might not otherwise have access. And I was familiar with the church location. I didn't know they also did something on Magnolia. It didn't register for me for that. Or if the church is on Magnolia, I don't know. Cherokee, there's some challenges with Cherokee and the way they're funded and being able to expand to do test patients that are not theirs. They are testing their patients. And so we talked this morning about different options. Certainly want to keep that option of the Free Medical Clinic in mind. Then we have to also think about how we can or cannot share testing supplies based on how we got them. That's just the honest truth. So we are open to partnering with those. And again, I have a team looking at one of the ideas they came up with is, do we start doing some pop-up, more community-based options as opposed to something at the Coliseum or the zoo, those kind of things. So they're brainstorming, realizing that a drive-through and a big event's not for everybody, and wanting to reach folks that haven't been reached yet. So you are definitely on our list of people to help us as we move forward brainstorming on that, Councilwoman McKenzie. So thank you.
Thank you for mentioning the pop-up events, because I was actually typing that. Would that be a possibility, especially Walter P., Western Heights, Vestal, some of those places. So look forward to working with you on that.
Okay.
Thanks.
You. And yeah, Cynthia Finch is involved, I'm pretty sure, in the free clinic. Yeah.
Yes, she is. Thank you.
So Commission Chairman Nystrom has asked a question just about sharing information about the Visit Knoxville Chamber Health Department partnership and communication strategy. And I can provide a little bit of information about that partnership, and then I might pass it over to Krista and to Dr. B to talk about the health department's landing page for COVID as well, which offers a lot of resources. So the Chamber and Visit Knoxville the city and the county have partnered to launch Knox Together. It's a website that can be accessed through Visit Knoxville. And the intention of that is really to help our community understand that businesses are reopening, and we need to do it slowly and carefully and safely to keep people safe. So it's sort of this idea that we want to let people know which businesses are open and help our community understand that it's a new normal, and their expectations for what will happen when they go into those businesses needs to change. So for instance, people need to get accustomed to seeing servers in masks, and they should be wearing face coverings themselves. The physical distancing guidelines. So those kind of things that are just not, it's not like we're going back to this pre-pandemic, just as Dr. Buchanan said, and Visit Knoxville and the Chamber are helping, excuse me, to spread that message, and are linking back to the health department's resources, which either Dr. B or Krista could maybe talk about a little bit.
Krista, feel free. I feel like I've been talking the whole time. So.
I'll let you have a minute to catch your breath. The health department's website has lots of information on it, but I'll talk specifically about that information related to the plan. There is a page that is linked from their main website. So if you go to knoxcounty.org/health, from there you can click to information about the reopening plan. And on that landing page, there is obviously the plan, but then there's also a link to employer guidance, which I'll go into a little bit. And then there's a link to the data and the benchmarks. So it's really kind of a hub for a lot of the things we've been discussing today. But when you click on the employer guidance, that's where employers are going to be able to sign up for that listserv that Dr. Buchanan talked about, and print off some signs that they can hang on their employee entrance and on their public entrance. The sign for the employee entrance has some basic guidance for employees, but also has a screener so that employers are asking their employees every day just a couple basic questions about potential exposure and about if they're feeling ill. And then the public facing sign, it goes over those 5 core actions that Dr. Buchanan went over. The listserv is up. People can get registered for that. It'll push out that educational information, and it'll also be the way that employers can get involved with submitting ideas for phase 2 and later phase 3. Dr. B, do you have more you'd like to add?
No, that you covered it. Our county, I can't say enough for how my staff has worked with county IT team members to really build out a very, very user-friendly website. And they've been very, very helpful to make adjustments as needed. So we're really appreciative of the teamwork there. So thank you.
Well, and I'll just put a little plug in. I think that Dr. B and her team have been amazing in getting this information out there. I think that the city has done, as best we can to help support that and amplify that message. Our graphic designer and comms team have been in constant communication with folks in the county and at the health department so that we can make sure that we're all on the same page with the messaging that's going out. But we need each of you to help with that as well. So any time that you can amplify, if there are media releases that go out, or if you see web links or social media campaigns to help promote really safety and respect, and that we are opening, but we're doing it as safely as we possibly can, that would be wonderful. Let's see, we've got a couple of other questions, and Councilwoman Singh wanted to know, I think, if this is the free medical clinic, if that's the clinic that Cynthia Finch is involved with, and I believe that is the case.
It is, yes.
So
That's correct, yes. Mm-hmm.
So Councilwoman Parker has asked, in one of the health department updates, she learned that the category of recovered refers to individuals who are no longer symptomatic. Do individuals need to test negative for the virus in order to be considered recovered?
So great question. And actually the short answer is no, you don't have to test negative to be considered recovered. So recovery is based on symptoms. So basically if a case is in isolation, that means they stay home and try to even be isolated from their family so they don't make their family sick for at least 7 days from onset of symptoms. And in addition to that, at least 72 hours of no symptoms without taking medications. So based on the course of disease, that length of time is long enough to consider them non-infectious. The reason the state of Tennessee decided to not use a negative test as declaring that somebody is in recovery are two reasons. One, initially really had to do with supplies. We just didn't have enough testing to do that. The other is that we actually shed virus. It can't make other people sick. We shed dead virus for a little while after we recover from most every illness. And so people continue to test positive just because the test is kind of sensitive, and they've actually gotten more sensitive as time has gone by. And so, you know, you have somebody shedding virus that can't make anyone sick, but they're still testing positive by the PCR test, which looks for the DNA of the virus. And so that's a challenge because there's really no reason for them to not be out in public. And then if actually after 21 days, if somebody ends up in isolation for 21 days, at that point, the CDC and the World Health Organization say there's no evidence to say that anyone is contagious after 21 days. If they're still symptomatic, there's something else going on with that person.
Got it. Thanks, Dr. Buchanan.
Sure. People keep moving around. It's confusing me.
Oh, the squares. People
Mhm.
log off and they log back
Yeah.
in. So it's
You
it's
moved.
keeping
You were over here.
keeping you awake this afternoon, Dr. B.
It's probably a
It's
good
Fri-
idea.
Friday afternoon.
Mhm.
Okay. I don't see any other chat questions. Krista or Hugh or I think Seema was on the call earlier. Does anybody have any other questions that were asked earlier that we might? Oh, there's another one that popped up. Here we go. Okay, good question from Councilwoman Singh, and that is contact tracing already in practice?
Well, contact tracing is in practice 365 days a year here at the health department, even outside the pandemic. We actually do contact tracing for lots of things year round. There are several diseases that are reportable to public health, and we actually do contact tracing on all of those here in Knox County. And that means we reach out to contacts and educate them and give them medicine if they need it, or give them a vaccination if they need it, or ask them to stay in isolation if that's what's indicated. Now, right now, contact tracing that we're doing is contact tracing on steroids. We've really ramped up our staff so that we're doing that. We're doing that 7 days a week now, so that, you know, we don't have the risk that somebody is a contact to a case and they're doing stuff over the weekend and potentially exposing other people. So we have stepped that up, and we have teams that rotate call so that not everybody's working every weekend.
Great. All right. Other questions?
There is another one that's just been added.
Oh, let's see. Did I miss it? Oh, have cases been in clusters?
Okay, I don't see it, but okay. Yes, we've had maybe 2 or 3 clusters. So a cluster by definition in this situation is 2 people with COVID-19 who have a common exposure. So it's a pretty low bar to set. We don't consider, well, we might consider a family a cluster if it goes outside the immediate family. So if the immediate family, that wouldn't necessarily be called a cluster, but it goes outside the immediate family, that might be called a cluster. So we've had some clusters. My staff has been able to work and find all of those folks who are potentially exposed, educate them, isolate them. And, we really rely on the history of the cases to help us know who's at risk. So it's really important. We all the time rely on people to give us the information we need to help protect the people around them and the public. So we really rely on folks to tell us everybody they've been around within a certain amount of time. And we reach out to those folks, and sometimes it takes us our goal is to contact them within 48 hours. Sometimes it doesn't happen because sometimes it's hard to get a hold of them, and we sometimes have to go back to the case and say, hey, have your buddy so-and-so call us so we can educate them and make sure they're not sick. So we get really good cooperation with that, but we do have some clusters, have had some clusters, and I anticipate that we'll probably continue to have occasional clusters.
Great. Any last questions for Dr. Buchanan or comments that anybody would like to make? Dr. B, I think that we have, I think all of the questions have been answered at this point. So I don't know if you have any final comments or words of wisdom.
So sure. So I know that you all get calls from lots of constituents, and I encourage you to do two things. If they haven't read the plan, to tell them to download it and read it. That may seem obvious, but sometimes people just want the answer. And also, if they've read the plan and they still have questions, 311 is doing a great job of supporting this reopening. Send them to 311. They've really stepped up and been a great partner in this. And if they can't answer it, they have a place to send it then. And also, I encourage you to do what Stephanie talked about earlier, sharing the link to our website and the information that we have. The city has some fabulous graphics. They have a really great graphic person, and I went and looked at their graphics a couple days ago, and they really have some great graphics that are really accurate and useful, and share those as well. The more information we can get out there in our community, the better off we'll be, the more likely we'll be in a month or so saying, okay, we're ready to move to the next phase. So thank you for all that you do, and thank you for taking time to be on this call with me today.
Martha, thank you for making the time today. I know we had you out this morning, and then again, that takes an awful lot of time. And I know so many folks have been getting questions, and it's just a great proactive way to help all of us. So thank you.
Happy to do it.
Thank you.
Thank you. See ya. Have a good weekend, everybody.
Thank you.